Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. I'm Anna, and as always, I'm joined by the brilliant Dr. Kota Reddy.
Thanks, Anna. I'm really looking forward to this episode because our topic is about blood thinners. And it's such a big topic, because they affect so many people and there's a lot of curiosity and confusion around them. It's something that comes up in my practice almost daily, so it'll be great to dive in and clear things up.
Oh my gosh, yes. I actually have so many friends and family members who take blood thinners, but I feel like there's still so much confusion about them. You know what I mean?
Absolutely. And that's exactly why I wanted to talk about this today. Like, there are so many misconceptions about blood thinners, when to use them, and more importantly, when not to use them.
Before we dive in, just a quick reminder to our amazing listeners to hit pause and subscribe to our podcast. You'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time.
And just to put this out there right at the start, everything we discuss today is for informational purposes only. Always consult your healthcare provider for any medical concerns.
So, Dr. Reddy, let's start with something that's been really bugging me. Why do we even need blood thinners in the first place?
Well, to really understand blood thinners, we first need to talk about blood clots themselves. And this is actually super fascinating because there are two completely different types of clots that can form in our body.
I had no idea there were different types. What are they?
So, we've got what we call white clots and red clots. And they're totally different in how they form and what they do. Let me break this down for you.
I'm all ears.
Okay, so white clots are basically, imagine a bunch of platelets, these tiny blood cells, all clumping together. It's kind of like, when you get a small cut, that's usually a white clot forming right there to stop the bleeding.
Oh, wow. So that's what's happening when I get a paper cut?
Exactly. But then we have red clots, and these are, they're actually pretty incredible. See, your liver produces these 13 different proteins. We call them clotting factors. And these factors work together to create this kind of fibrin web that catches red blood cells, forming this bigger, thicker clot.
That's actually kind of amazing. But why do we need two different types?
That's a great question. So think of it this way. Those white clots, they're like your body's first responders. They're perfect for those small everyday injuries, like your paper cut example. But red clots, they're more like your body's heavy-duty response team. When you have a more serious injury, that's when your body needs to bring out the big guns, and that's where those red clots come in.
Oh, so it's like different tools for different jobs?
Exactly. And you know what's really interesting? Understanding these different types of clots is absolutely crucial when we're talking about blood thinners because, different blood thinners target different types of clots.
So if I'm understanding this right, does that mean not all blood thinners work the same way?
Yes, that's correct. And this is actually super important to understand. You see, blood thinners are really specific in what they target. Like if you're trying to prevent white clots, you need one type of medication. But for red clots, you need something completely different.
Really? Can you give some examples?
Of course. So let's talk about medications for red clots first. These are the ones you take for things like deep vein thrombosis. Those are clots in your legs. Or if you have atrial fibrillation and you're worried about strokes. For these, you typically use what we call factor blocking agents.
Those sound serious.
They are. We're talking about medications like Eliquis, Xarelto, Pradaxa, or Savesa. And what's really cool about these newer medications is that, unlike the older drug Coumadin, you don't need constant blood tests to monitor them. They just work.
Oh, wow. That's actually really convenient. But what about white clots?
For white clots, which are actually the ones that typically cause heart attacks, you'd use completely different medications. We're usually looking at aspirin and Plavix for these. And here's something interesting. Did you know that less than 3% of strokes are actually caused by white clots? That's why it's so important to know which type of clot you're dealing with.
That's fascinating. So you really can't just take any blood thinner and expect it to work for everything?
Exactly. And you know what's even more interesting? These medications don't cross-protect. Like if you're taking something for white clots, it's not going to help prevent red clots, and vice versa. It's kind of like, Imagine having two different types of locks on your door. You need the right key for each one.
Oh, that makes so much more sense now. I always thought blood thinners were just blood thinners.
Right? And that's exactly why we need to be so careful about which medications we prescribe. It's not a one-size-fits-all situation at all.
So, this might sound like a silly question, but should healthy people take blood thinners just to, prevent problems?
Oh, I'm so glad you asked that. The short answer is generally no. Look, I know it might seem like a good idea to be proactive, but blood thinners aren't like taking your daily vitamins, you know?
Really? Even something as simple as baby aspirin?
Here's the thing. Blood thinners, even aspirin, they're really powerful medications. I've actually seen some pretty scary cases. Let me tell you about two colleagues of mine, both doctors actually, in their mid-60s. They were taking daily aspirin just to be safe, you know? Well,
Oh no, what happened?
they both had falls. Nothing major, just regular falls. But 2 weeks later, they developed these large subdural bleeds in their brains. If they hadn't gotten scans, well, it could have been catastrophic.
That's terrifying. And this was just from regular aspirin?
Yes. And that's why I always tell my patients, don't take a blood thinner unless there's a really clear reason for it. Like if you have atrial fibrillation and you're at high risk for strokes, then yes, something like Eliquis or Xarelto makes sense.
What about people who've had stents put in?
Ah, great question. So for stents, you typically take aspirin and Plavix, but usually just for a year. After that, I generally recommend backing off. Maybe stick with aspirin for a couple more years, and then you can actually stop completely.
But what if someone has like multiple risk factors?
Well, in those cases, we might start with both types initially, but after a year or two, we usually take them off aspirin and Plavix and just continue with something like Xarelto for stroke prevention. The key is we're always looking to minimize medication while maximizing protection. Does that make sense?
Yeah, it totally does. It's like better safe than sorry, but also better not to take unnecessary risks.
That's right. And you know what? Sometimes the best protection isn't medication at all. It's about lifestyle changes, staying hydrated, maintaining a healthy weight. Those things can often keep you off blood thinners altogether.
You mentioned risks earlier, and I'm really curious about that. What are some of the, dangers we should be aware of with blood thinners?
This is actually very important to talk about. You see, when you're on blood thinners like aspirin or Plavix, bleeding is the main concern. And I'm not just talking about little cuts taking longer to stop bleeding.
Really? What kind of bleeding are we talking about?
Well, I've had patients come in with these pretty dramatic bruises all over their arms and legs. And while that's concerning enough, what really keeps me up at night is the risk of internal bleeding, especially in the brain.
Oh my gosh, that sounds serious.
It really is. Let me share something that really drives this point home. I had this patient, and this story still affects me, who was on Coumadin. His INR, that's how we measure how thin the blood is, was only at 4, which isn't even extremely high.
Uh-huh.
And, well, he developed bleeding in his brain, and he didn't make it. It happened so fast. And that's why I'm always careful about prescribing these medications.
Wow, that's heartbreaking. Are there any warning signs people should watch for?
Absolutely. Look, if you're on blood thinners and you start noticing unusual bruising, that's a red flag. But what's really crucial is if you have any head trauma, even if it seems minor, or if you start getting severe headaches, unusual weakness, or confusion, you need to get medical attention right away.
So it's like you really need to weigh the benefits against these risks?
Right. Different blood thinners carry different risks. Like the newer medications such as Eliquis or Xarelto, they actually tend to have more predictable effects than older ones like Coumadin. But still, we have to be incredibly careful with all of them.
That makes total sense. And I guess that's why you mentioned earlier about not taking them unless absolutely necessary.
Yes, exactly. Every prescription is really a careful balance between preventing dangerous clots and avoiding these serious bleeding risks. It's not something we take lightly, that's for sure.
Speaking of risks, I've heard dehydration can play a role in blood clotting. Is that actually true?
Oh my goodness, yes. You know, this is something people often overlook, but dehydration is actually one of the biggest triggers for blood clots. When you're dehydrated, your blood gets, well, think of it like this. It becomes thicker, more viscous, and starts flowing more slowly.
Really? I had no idea. So what kinds of things cause dehydration?
Well, it's fascinating actually. There are so many everyday things that can lead to dehydration, like starting your morning with coffee, which, let's be honest, most of us do, that can actually be dehydrating, or eating really salty foods, having a few drinks at happy hour, spending time outdoors without drinking enough water.
Oh, wow. Those are such normal things, though.
Exactly. And here's what's really interesting. Even people with chronic conditions like atrial fibrillation don't have strokes every day. They might have one annually, and guess what often triggers it? Dehydration.
That's kind of scary. So what's better, staying hydrated or taking blood thinners?
You know what? In many cases, and this might surprise people, proper hydration can actually be more effective than medication for preventing clots. I mean, think about it. Instead of putting someone on blood thinners prophylactically, which comes with all those risks we talked about earlier, why not focus on staying well hydrated first?
So how much water should people be drinking?
Well, it's not just about drinking a specific amount, it's about being mindful of your hydration throughout the day. Like if you're going to exercise, make sure you're hydrating before, during, and after. If you're taking diuretics, water pills, you need to be extra careful about your fluid intake.
Oh, that makes so much sense. And I guess staying hydrated is good for everything, right?
Absolutely. Water is it's essential for so many bodily functions. And the beautiful thing is, unlike blood thinners, there's virtually no downside to staying well hydrated. It's nature's way of keeping our blood flowing properly.
So Dr. Reddy, what about people who really want to avoid blood thinners altogether? Are there other options they can explore?
Oh, yes, definitely. And this is something I'm really passionate about because, there are actually quite a few alternatives depending on your specific situation. Take atrial fibrillation, for example. We've got several really exciting options nowadays.
Really? What kinds of options?
Well, first there's ablation. It's this amazing procedure where we can actually go in and, basically fix the irregular heart rhythm at its source. Then there's the Watchman device. It's this fascinating little implant that helps prevent clots from forming in a specific part of the heart.
Oh, wow. I had no idea there were actual devices for this.
And that's not all. You know what's really interesting? Sometimes the solution is much simpler. Like if someone has sleep apnea, which by the way is super common, treating that condition alone can make a huge difference. Or sometimes it's just about losing some weight, improving diet. It's about looking at the whole picture. Exercise, stress management, good sleep habits, they all play a role. And the beautiful thing is, these lifestyle changes don't just help with clotting issues, they improve your overall health too.
They seem like much safer options than blood thinners, right?
Right, and that's exactly why I always encourage my patients to explore these alternatives first. Medication definitely has its place, but if we can achieve the same results through natural methods, well, that's always going to be my preference.
Dr. Reddy, this has been such an eye-opening conversation about blood thinners. I feel like I've learned so much today.
Oh, I'm really glad we could dive deep into this topic, Anna. If there's one thing I want our listeners to take away from today's episode, it's that blood thinners aren't something to take lightly, or just because someone suggested it might be a good idea.
Right, and staying hydrated seems super important too.
Absolutely. And speaking of which, let me just emphasize this one more time. Hydration is often a better preventive measure than medication. But remember, everyone's situation is different, so always consult with your healthcare provider about what's right for you.
Thanks so much for sharing all this knowledge with us today. Before we go, I just want to remind our amazing listeners to hit that subscribe button if they haven't already. You'll get notified about new episodes and gain access to some really cool, exclusive content.
And please remember, while we love sharing this information with you, this podcast is for informational purposes only and isn't a substitute for professional medical advice.
That's right. Well, thanks for tuning in to another episode of Everyday Health Stories. Until next time, stay healthy and stay hydrated.
Couldn't have said it better myself. Take care, everyone.